Hey y'all, I just wanted to do a really quick Facebook Live with Dr. Petro before she goes in to see some patients for this afternoon's clinic. I just want y'all to know this is my first video on my new tripod. I feel very fancy. I told her we look like newscasters. One of the things that we wanted to talk about, just because I correspond with patients so much throughout the week, very important questions. We've been kind of highlighting CoolSculpting. So I want to talk to Dr. Petro now about pros and cons between CoolSculpting and liposuction. Honestly, majority of our patients who come in now, even for a lipo consult, we ended up signing up for CoolSculpting. Why do you think that is? What are the pros and cons for the CoolSculpting versus liposuction?
Well, for the most part, it comes down to how old you are and how your skin is. I can tell you liposuction can be terrific for taking an area and being able to spot reduce it. As a child, my sister, you know how sisters are, used to come in and saying, calling me Thunder's Eyes and saying, you know, you ought to do this. And it was the Thigh Master from Suzanne Summers. Anyway, the day that I found out that Suzanne Summers had liposuction and just not told anybody was the day I was like, I'm going to have liposuction. Because I felt like I wasn't getting anywhere and I was really frustrated. And I mean, I really did. My thighs were just out of proportion to the rest of my body. So you're trying to wear jeans and the waist is too big, or there's always some piece of clothing, because that's what most of us do, is we want to look better for our clothes, because clothes just weren't made for people that haven't reduced something, whether it's your jeans low and your love handles kind of coming over the sides, or the way you feel in dresses when you have a real small waist and big thighs. And most of that's genetic, and there's not much you can do about it, and there's not an exercise or a thigh master that'll make it better. So I've had liposuction. I know how much it can do, and I think it's terrific when it can do it, and when you're as young as I was at the time. Problem is, as you age, your skin ages, and we can all touch our skin and tell that it doesn't feel, well, not all of us, but those of us over 40, you can feel the skin.
Is when it starts.
It's not true. And you can tell that it's not as tight as it used to be. So when you get to a point where you can do something about it, usually you are a little bit older, and CoolSculpting is great for that. Your skin isn't required to bounce back with CoolSculpting the way it is with liposuction. I certainly still do liposuction. I can tell you, gosh, I mean, I can, typically it's with a facelift for people that have skin, you know, a good bit of fat here. I can do some liposuction there because I'm doing a facelift anyway and tighten the skin. But very rarely am I going to do it alone without offering CoolSculpting, because the results we get from CoolSculpting are so good. And, you know, liposuction's probably more fun for me, but it's not as good for any of us. So, I mean, it's been really a hard sell for me. And I don't really sell. I just tell people, you know, here's what you can get with CoolSculpting. Some people there are people that just want one treatment, and they have good tight skin, and maybe they want more than what CoolSculpting can do in one treatment. But maybe one of those in the past several months. For the most part, we can overlap the applicators for CoolSculpting to where you get two treatments, basically two treatments in one. So it works better. It doesn't give you any downtime.
CoolSculpting is very, very customized per patient, which I know is kind of frustrating. We have a lot of people messaging, commenting, asking about price, and it's, you know, I wish that I could give you a set number. The thing with the CoolSculpting is it's absolutely imperative that you come in so that we can look at you and measure you, decide which handpiece that is best for the area that you desire to have CoolSculpted, and then of course we will determine how many cycles you need.
And some people just want an estimate. I mean, I can promise you we're fair. I'm always going to be fair with people and love it when people are fair to me. So I completely understand that it feels like we're not just being forthright about it. You can email me pictures, and some people do, and I can at least give you a better idea. Mm-hmm. It's one of those things that's hard to compare. Like, if, for example, if somebody came in and wanted to do their abdomen, and you do their lower abdomen, sometimes if they have a little bit of fat in their upper abdomen, all of a sudden that can look bigger. I've CoolSculpted just my abdomen, my lower abdomen, and love it. But I didn't need as much up here. But even if you kind of have to look at it as a big picture. If you want to do your abdomen and your flanks, sometimes you can overlap on the sides. But it's like you have to go till it, can I show them on you?
Yeah.
Do you have any fat anywhere?
Well, my panties.
But you have to go till it tapers. So Chloe's got a really flat abdomen. But if I took a little bit here, that one of those cycles would go kind of from here to here. And she tapers. So this would be a good spot. Well, I mean, she doesn't have anything. But if she did, that would be a good spot. If you had a lot right here, which most of us do, you can overlap the applicators to where the area with the biggest gets treated twice. So it's like having 2 treatments. It's not painful. I mean, it was developed by 2 doctors at Harvard, and basically
talk to them about downtime.
Okay.
I think that's probably a big thing, and that's kind of a no-brainer for a lot of our patients who love the CoolSculpting, is the convenience of being able to come in literally on your lunch break and do a treatment and go back to work, and nobody knows you've had anything done, and you're not in any kind of pain.
But with the other thing is the skin. So if you envision this as the top of your skin, and then this as it comes up, this is like, when you go through this, you have to go through it with liposuction to get the fat out of the little pockets. I have actually a very good example. And yes, I'm going to eat this cherry afterwards. These are my favorite things ever. So imagine, I was looking for something. Imagine this is what's holding the red, the little cherry part would be the fat, and I couldn't ruin these for myself because I like them too much. But the bottom of this could be the fat, and then this little stem is the part that comes up to the skin. With CoolSculpting, you grab that and pull it away and you freeze it, but it doesn't damage the stem. With liposuction, you have to, sorry, little cherry. You do it like this, so now you don't have the top. I mean, I know you're not liking that, but it's the truth. And then you're counting on the skin to contract back down, and so that's what we can't do with liposuction. And we've tried lasers and heat, we've tried ultrasound. There have been so many different forms of liposuction trying to tighten the skin, but it's just not, it just doesn't happen. Chloe's battery's about to go down. So,
I've been staying active on Snapchat, but we just kind of wanted to check in with you guys and do a really quick Facebook Live before we go in the clinic. I promise it's not going to die. Before we let you guys go.
On it all the time, but we found a use for it.
Yes, before we let you guys go, though, we just wanted to talk about those were popular questions this week, and we wanted to address them. And then in the beginning of the week, we talked about what makes you feel old, and I felt like an overwhelming response was about the neck area and, skin crepiness. That was a word frequently used. But we had a lunch and learn today with a new vest guy, and we are giving away one of our awesome masks that Dr. Petro is absolutely in love with.
I do love these.
We talk about them all the time. They have a new one for the neck area, and since I thought that was so perfect for a lot of you guys that commented this week, we're going to give one away, and it's on Snapchat, so be sure to follow us. Her handle is Dr. Melanie Petro, and then if you guys have any other questions for us.
I have one more thing to say if your battery doesn't die.
Okay, go ahead.
I think one of the main differences with CoolSculpting is the fact that you can sculpt. I mean, we all want to do that with liposuction, and you really try, but you have to put, you don't get the same feeling that you're able to just take a smaller amount and have it, even with the smallest of cannulas. And it just, the difference in the downtime, liposuction makes you sore.
Yeah.
I can't imagine. If anyone tells you that it doesn't, I'd like to know if they've had it, because it really did hurt. And I had started my residency the next day. My dad's probably, I'm sure he's not watching. And I didn't tell anybody, so, I was walking around, and trying to get up and down and, not let people know what I'd done, which was a little bit difficult with CoolSculpting. I was walking my little angel Gabe the next morning, and it just wasn't hard. So, there is just something to being in pain, but you're in pain because it's just a much more traumatic procedure than CoolSculpting. So I'm a big believer, and I'm not somebody that would just tell you that. I've had them both, and we would never have anything in this office. That's why we're so weird about skincare. If it breaks me out once, because I normally don't break out, it's gone. We do not carry it under any circumstance. So
if there are any more before and afters that you guys have any requests for, I know I posted some of Katie's abdomen yesterday on Snapchat, but if you want,
take some. I haven't taken it yet.
Yeah, we can post them on Facebook. We've
What
done
did you do? Her chin.
her from her first treatment. We
And
did
Katie
not
has
CoolSculpt a
great-
pregnant girl. We did not.
Katie,
That's about her pregnant.
I was making sure you didn't do the afters then. Katie eats awful too. She was eating pizza the day of her CoolSculpting, so I can
No
promise
judgment,
you.
though. No judgment.
Inner thighs. Somebody's asking us about inner thighs. That's a tricky area. I mean, you would certainly not liposuction over the age of 18. I mean, we all know how that skin is. It's really, really different. But we can CoolSculpt it. We have some brand new applicators that came out, maybe 2 weeks ago, and they're able to not have to pull as much with the suction. So we mostly got them because they're more comfortable, but the treatment's also quicker. We have 3 machines in a real, private area. I mean, if y'all are wondering if CoolSculpting hurts, I mean, there are a lot of men that do it, and we all know that, men can't handle pain. So I can assure you, we wouldn't have any, men wouldn't do it if it hurt.
We've had a lot of male patients do it, and they're very happy. All right, so
Thank you, male patients.
there's our cue. We're wrapping up. We're heading to clinic, but any questions, just let us know, and thank you guys for tuning in. Have a great Thursday.